Hello, everyone, and welcome to the Reprogram podcast. I'm your host, Dr. George Murphy. On this podcast, together we will explore topics related to reprogramming yourself, achieving resilience against disease and disability, as well as examining, from a rigorous scientific point of view, the realities of age reversal. So, like a comic book, everything and everyone has an origin story, including our little podcast. So for the last decade or so, my laboratory and the center that I co-founded have harnessed the use of a special kind of master stem cell called an induced pluripotent stem cell, or an iPSC for short. We've then used these cells to model diseases in a dish in an effort to develop novel therapeutics using sort of a personalized medicine approach. So yes, I know there's a ton to unpack in that last sentence, and I promise we will get to many of these complex topics in future episodes. But for today's introduction, it might be simpler to think of iPSC stem cells, for you Lord of the Rings fans out there, as the one cell to rule them all. And that remarkably, these master stem cells, which we can literally create from any individual, have the ability to create any cell or tissue type in the body. So what you'll notice is that each cell or tissue type that we create is also associated with a particular disease that we study. So this is where the name of the podcast first breathed life. The ReProgram, the method that we use to create these master iPSC stem cells from just a teaspoonful of your blood, is actually called reprogramming. And that fits hand in hand with our overarching philosophy of also reprogramming ourselves to live more healthful and robust lives. So we've developed novel stem cell-based models for different disease processes for about a decade, and we've been very successful in doing so. Nonetheless, about 2 years ago, I had an existential crisis in which I started to consider the fact that maybe our approaches might be wrong. So I honestly believe that having this type of existential crisis is productive for anyone working in any field, as it forces us to re-examine how we're approaching things operationally, but also both emotionally and philosophically. So in my case, the question that became central to our new approach is focusing on disease the right choice? So I began to question many things, including a healthcare system that's built upon the treatment of chronic diseases rather than prevention of disease itself. I thought about the fact that we train our next generation of scientists and clinicians to recognize anomaly, to treat and counsel individuals at system-critical time points only when something is wrong, rather than putting significant time and effort into helping people adapt to focus on things like health and longevity. And yes, I do feel that I'm extraordinarily lucky and that I get to be a scientist in an era when transformative therapies are really beginning to move from the bench to the clinic and have the ability to potentially cure diseases that have plagued us for decades. But this process has been fraught with missteps and is extremely slow. So drug discovery is extremely time-consuming and expensive, and many of the treatments for diseases like Alzheimer's disease have resulted in extremely disappointing results and really no clinical or therapeutic utility. So one of the possibilities as to why this might be occurring surrounds the very process we've relied on for so long in the lab. Develop a disease model, and then, of course, use this model to come up with the treatment for the disease in question. What must be considered in this scenario, however, is that once the disease has manifested itself, then potential treatments and cures might be inefficient or ineffective, particularly if the disease has progressed significantly. So, what this existential crisis brought about was a radical new way of thinking in which we've really flipped the equation on its head. So instead of focusing on disease, we instead study resilience, or something called dynamic resilience, which can be defined as our ability to productively respond to insult and injury. So the hypothesis here is that just like we know that there are genes that drive disease and disorder, then there must be mechanisms that also drive resilience or resistance to the disease. So the best example of this type of dynamic resilience is in centenarians, or people with something called exceptional longevity, so people that live to 100 years or more. And from these really specialized, unique individuals, we've begun to learn how the genes, transcription factors, things like protein interaction networks, how they all come together to allow these very, very special people to sometimes evade or completely eliminate aging related disease. Fantastic. So that means that everything is possible. So, in upcoming podcast episodes, we are going to explore all of these themes and more, including the history of iPSC master stem cells, how we make and manipulate these cells, the fact that no one really understands or can even completely define what aging is. And we'll also have the opportunity to speak with world experts on things like exceptional longevity and centenarians. We're going to explore the realities of age reversal and much, much more. So please follow our podcast and join me on this journey of understanding and self-discovery as we navigate our way into the fields of longevity, aging biology, regenerative medicine, and the emerging field of geroscience.